our patient now had their call light on. They have something that they need, and we're going to go in with our lab coat, our mask, and our goggles that we have already used once this shift. So we are reusing these. I'm going to start with doing some hand hygiene, using that hand sanitizer, and grabbing a pair of gloves. I'd recommend going with one size up from what you normally use, because it'll be a little bit easier to get off, and I'll show you when we get there. So when you are grabbing your lab coat, you want to try to grab just the inside when you're putting it on, making sure it's your lab coat, and trying to have the inside as the part that's going to touch you and avoid getting any of the outside on you. So I'm putting that on, put my gloves through, and this is why we want the gloves on, because we're going to be touching the zipper and some of the outside. So to minimize contamination, we want to keep the gloves on. And now to make it easier to get off, this is why you want the bigger gloves, because you're going to pull the gloves off with each finger. And then you're going to do your hand hygiene again. And you're now going to put on the set of gloves you're going to use once you go in the room. And now you are going to reach in to your mask bag, trying to touch the loops only, putting the loops around your ear, and you're going to wait to adjust your mask until you've got your goggles up towards your face. Because still at this point your gloves should be clean if you've only touched the loops, and if you're touching your clean goggles on the outside. So you're going to bring your goggles up to your face, adjust your mask where you need it, and then put your goggles on, and you're ready to go into the patient room.